Hello, my name is Esther Brew. I'm in my Nightingale scrubs, and I have my Nightingale name badge on. I have no nails or nail polish, and my hair is tied up. So today we'll be conducting the neurological assessment. So first I'm going to start by knocking and entering the patient's room and providing hand hygiene, and going over what the procedures are for the neurological assessment. Knock, knock. Hello, my name is Esther. I'm going to be your nurse for today, and I'm going to be conducting a neurological assessment on you today. So the neurological assessment is just a test that assesses your neurological system to make sure everything is working intact. Is that okay with you?
Yeah.
Okay, and then during this test, I will be touching you. I will be lightly poking you with objects. Is that okay? Patient verbalized consent. I'm going to go ahead and perform hand hygiene, and then I'm going to go ahead and identify the patient correctly, and get the patient's orientation. But for the video's sake, I'm just going to have the patient state his name, and I'm going to double check identity with the name bracelet. So go ahead and tell me your name.
Justin.
And is the correct patient, and then patient is alert and orientated times 4. All right, so like I said, we're going to be conducting a neurological assessment, and this test is just going to make sure everything's working intact. So the first test that we're going to conduct is the sensory responses to superficial touch and pain. So for this test, I will be touching you with various objects. I have a cotton swab or ball, and I have a pen that has a sharp end and a dull, clicky end. So, Chasta, for this test, I'm going to poke you or touch you with these things, and you're going to tell me if it feels dull, sharp, or just feels like a regular touch. And you're going to do this with your eyes closed. And then for some of these tests, your eyes will be closed. Some of them, your eyes will be open, and some of these tests will be performed bilaterally. In a clinical setting, these tests will be performed bilaterally on both sides, but for the sake of the video, the majority of these tests will be performed unilaterally. All right, Chasta, so go ahead and close your eyes for me. Then I'm going to go ahead and touch him with the various objects, and you're going to tell me what they feel like. So what does this feel like?
It feels like it's soft.
And then, what does this feel like?
Sharp.
And then what does this feel like?
No.
All right, and then the patient was able to correctly verbalize the correct responses for the test. Go ahead and open your eyes. And then next, we're going to perform the perception of position sense with movement. So for this test, I'm going to have you put your hands out, and also your feet, but we'll get to the feet in a second. And then for this test, I'm going to move one of your fingers, and you're going to tell me whether it feels like I'm moving it up or down. This will be a bilateral test, and you're going to tell me, and your eyes will be closed, and you're going to tell me whether or not it's moving up or down. So go ahead and close your eyes, and then go ahead and tell me what position this is moving in.
Down.
Okay. And then tell me this position.
Up.
Okay. And then for your feet, go ahead and tell me what position this is moving in.
Down.
Okay. And then the other foot, sorry. Go ahead and tell me what position it's moving in.
Down.
Okay. And then patient, go ahead and open your eyes and put your hands down. So patient was able to correctly describe which movement the fingers and toes are moving in. So next we're going to assess the ability to identify familiar objects. So for this test, Chasta, I'm going to put something that should feel familiar to you in your hand, and then you're going to tell me what it feels like. In this test, your eyes will be closed, and this will also be a unilateral test, but in the clinical setting, this would be a bilateral test. So go ahead and close your eyes, and take your hand out and open your palm. Yep. And then close your hand, and then go ahead and rub it around and tell me what it feels like.
Feels like a hair clip.
Okay, and then the patient was able to correctly identify that it is a hair clip in his hands. Go ahead and open your eyes. And then for the next test, we're going to do the 2-point discrimination. So for this test, I'm going to open the hair clip, and I'm going to lightly touch you with it, and you're going to tell me what it feels like, either 2 points or if it feels like 2 things or 1 thing. And your eyes will be closed for this also. And again, this would be a bilateral test, but for the video, it's just a unilateral. So go ahead and close your eyes, and then I'll take your hand. And then you tell me how many points do you feel?
2, 2, 1.
Okay, and then at this point, I would note or notate where the patient I would notate and measure where the patient feels the hair clip feeling like 1 point. And go ahead and open your eyes. Okay, and the next test I'm going to assess the ability to identify letter or number drawn in the hand. So for this test, I'm going to take your hand and I'm going to draw a letter or a number in your hand with your eyes closed, and you just tell me what it feels like. Go ahead and close your eyes. Okay, and then what was drawn in your hand?
3.
Okay, and then the patient was correctly able to identify that a 3 was drawn in his hand. Next, we're going to assess the ability to identify a body area when touched. So for this test, go ahead, open your eyes. So for this test, Chasta, I'm going to go ahead and touch you, and you're just going to touch back where I touched you at, but your eyes will be closed also. And this will be from head to toe. Okay, so go ahead and close your eyes. And then you go ahead and touch where I touched you at. Okay. Okay, and then I don't know if you can reach down here. All right. So the patient was correctly able to touch the body areas that were touched. So next we're going to do the deep tendon reflexes of the plantar and the biceps. So for this, go ahead, open your eyes. So for this, I'm going to go ahead and test your reflexes of your biceps and your plantar. So for this, your arm's going to be relaxed. Relax. There you go. And turn over this way. Okay, and I'm going to place my thumb over the bicep tendon, and I'm going to lightly tap with the pointy end of my hammer, and then it's going to elicit a response. So you're going to feel a light tap. 1, 2, 3. Okay, and then patient's arm demonstrated the correct reflex. And then next, I'm going to go ahead and do the plantar reflex. So for this one, I'm going to also feel for the tendon just below the patella. And this one, I'm going to lightly tap with the blunt side of my of my hammer, and then it will elicit a response. So 1, 2, 3. Okay, and then the correct response was elicited. So next, I'm going to assess for ankle clonus. So for ankle clonus, I'm going to dorsiflex the foot and then let it drop. So a correct response would be, or a normal response would be that the foot relaxes. But for a positive clonus, the foot would kind of jerk coming down. So Chasta, I'm going to go ahead and take your foot, lift it up a little bit, sorry. And then I'm going to flex it like that, and then go ahead and relax your foot. Okay, and then foot was able to drop at a regular rate, no jerking. So no clonus. Next, I'm going to assess the cerebellar function and proprioception. So for this test, Chasta, I'm going to have you take your ankle, your right ankle or your right back of your foot, and rub it down your shin, and then same thing for the left foot. So go ahead. Okay, and patient was able to correctly perform the test. So next, I'm going to evaluate a coordination of fine motor skills by rapid rhythmic alternating movements, and I'm also going to assess the accuracy of the upper body and lower extremity movements. So for this test, Chasta, I'm gonna have you put your fingers to your nose, doing this, and then you'll do it with your eyes closed. And then go ahead and close your eyes, and then try to do it faster. Okay, go ahead and stop. So patient was able to correctly perform the action. There's no hesitation, and patient was accurate with demonstration. So next I'm going to evaluate the patient's balance using the Rumberg test. So Chasta, go ahead and stand up. And for this test, I'm just gonna have you stand for 60 seconds. And I have my watch here to accurately tell for 60 seconds. So for this test, I'm not going to hold the patient, but I will be here to catch him or assist him if he needs help. And so Shasta, for this test, you'll be standing for 60 seconds, and I'm just going to observe how you stand. And if you feel weak or anything at one point, just let me know and I'll have you sit down. So this test is conducted for 60 seconds, but for video's sake, I will do this for 10 seconds. So are you ready? Okay, then go ahead and we will begin. Okay, and then the Rumberg test is complete, and patient was able to perform the test with no problems. So next, Shasta, I'm going to have you remaining standing. So next, I'm going to observe the patient's gait in rhythm, and see how the patient walks, and see if there's any obvious like arm swinging or obviously any obvious gait imbalances. So go ahead and walk for me. Okay, and then come back. Okay, and then the patient's gait was good, patient's posture was good, patient had a great rhythm, and patient had a good stride and no obvious arm movements. You can have a seat. Okay, so then after this, I would go ahead and document what my findings were and explain to Shasta that the test is over and relay everything to the doctor. And that is it. Thank you. The end.